All right, hello and welcome everyone to our latest event in the precision medicine and solid tumors event space. Thank you for tuning into this talk, and we look forward to bringing you more presentations in this space in the upcoming months. Today, our speaker is Dr. Anil Parwani from The Ohio State University, who will be discussing AI revolution in diagnostic pathology. Is the tide turning? Here's a look at today's agenda. My name is Ian Moore, and I am a lab relations manager with Diagnostic. I'll provide a short background about Diagnostic as a whole, as well as DXRX, our free precision medicine platform for labs. I'll then turn it over to Dr. Parwani for his presentation. At the end of the presentation, we'll dedicate some time for Q&A where we'll answer your questions. Please note, you can ask questions at any time during the talk by typing them in the box below this presentation. Diagnostics is an end-to-end services provider and data analytics company specializing in precision medicine. Our mission is better testing, better treatment, and we are building towards a future where the testing ecosystem allows all patients to receive the right treatments at the right time. We believe that labs need to be involved earlier in the precision medicine decision-making process. We've worked on every precision medicine brought to market with 36 of the top 40 pharma clients, and we have experience in 96 disease pathways. Additionally, our global presence across 53 countries enables knowledge sharing across a vast range of topics. All diagnostic labs can find a benefit from a DXRX registration, regardless of shape or size, and we see this collaboration having a positive patient impact all over the globe. Our goal is to break down global barriers between labs, and we see DXRX as the way to accomplish this. A DXRX lab membership enables you to be the first to hear about exciting sponsored scientific studies and DXRX collaborations, provides access to lab talk and lab webinar recordings, precision medicine reports, biomarker reports, and DXRX live newsletters. And it also allows you to be part of our data-driven recommendations to increase your visibility to precision medicine stakeholders. On both the left side of the screen and in the DXRX booth in the exhibit hall, you will find a link where you can schedule a meeting with a lab relations manager to learn more about DXRX and joining our lab network. We'd love to meet with you. It is now my pleasure to introduce Dr. Anil Parwani. Dr. Anil Parwani is a professor of pathology at The Ohio State University. He serves as the Vice Chair and Director of Anatomical Pathology, and he is also the Director of Pathology Informatics and Director of Digital Pathology. His research is focused on diagnostic and prognostic markers in bladder, prostate, and renal cell carcinoma. Dr. Parwani's expertise in the area of surgical pathology, viral vaccines, and pathology informatics, including biobanking, whole slide imaging, digital imaging, telepathology, image analysis, artificial intelligence, and lab automation. Dr. Parwani has authored over 350 peer-reviewed articles in major scientific journals and several books and book chapters. Dr. Parwani is the editor-in-chief of Diagnostic Pathology and Journal of Pathology Informatics. Dr. Parwani is a prominent influence in digital pathology, and we're very excited to have you here with us today, Dr. Parwani. And with that, I'll turn it over to you.
Thank you so much, Ian. This is a great opportunity, and I'm glad that this is a very timely topic and very dear to me in terms of how it's going to impact diagnostic testing, diagnostic pathology, precision pathology. And I'm going to focus my talk on digital pathology and AI and focus on the practical aspects of it. Where are we today? Where is it going? So this is a beautiful view of Columbus, Ohio, which is where I am currently. So I want to provide to you today an overview of evolution of digital pathology and AI and what is its current state. What can we do today that we couldn't do yesterday? And where is this field going? Pathology is generating, the lab is generating a significant amount of data, upwards of greater than 50% of what makes its way into the electronic medical record and ultimately is used for precision medicine, especially in cancer diagnostics. So I want to explore with you the different ways AI has been incorporated into the diagnostic process within the lab and how potentially this will get even more prominent in the digital workflow and AI usage. So all this data, it's an exciting time to be in pathology and medicine in general. 2023, I would say, was the year of AI for the labs in terms of the introduction to AI, in terms of all the data that we're generating, and trying to convert all these pipelines of data into knowledge, into towards precision medicine, towards precision pathology. Now we have an ability to fine tune a diagnosis. So one of the big things I want to focus on is how do we create a digital workflow? How do we create a pixel pipeline which enables us to go from a class slide to millions of pixels, which can then be used for AI? So I want to focus on digital and computational pathology and focus on areas where I think there are a lot of improvements. So, what are we trying to address, right? What are some of the challenges even today in 2024? We have staff shortage, we have pathologist shortage, and the workload is increasing. We also have more knowledge about cancers than ever before. Things that I learned in medical school and in my residency have amplified in terms of the information about the right diagnoses and the translocations and how do we treat these patients, right? So there are, even in spite of all the progress, we still have several manual processes in the labs today and a lot of subjective diagnoses. But there are opportunities to keep improving these. If you look around the world, there is at the pathologist pipeline, and this is true for even technologists, there is a constant demand and patchy supply. So some parts of the world, there is less than one pathologist per million people. So this. If you look at the United States and Canada, where all the green highlights area are the ones where there is significant number of pathologists more than these other parts of like Africa and other parts of Asia and so on. So you can see clearly there is a need for pathologists. What about the role of pathology in cancer diagnosis? If you look at the 2030 estimates, 22 million new cancer diagnoses. And even though we have made significant progress in treating cancer, the number keeps going up. Pathology is the central hub for review of these cases and providing diagnosis to the patients, objectively reviewing these cases, maximizing research collaboration, and looking at all these different methods in collaboration with oncologists to treat the patients. So the cancer burden and the knowledge of the cancer continues to increase in the face of reduced number of pathologists and lab technologists. So these are the challenges, right? So lack of standardization, subjectivity, more manual processes, shortage of pathologists. Pathologists claim they are overworked, explosion of medical knowledge, time consuming tasks like counting cells. How do we mitigate this? How do we solve some of those problems? And this is where AI can help us. This is where digital workflows can help us with more standardization, with more objectivity, with more collaborations, maybe even more accuracy and speed. So we have more time to do other things. And pathologists can actually spend time to keep up with the knowledge about the new cancers and new diseases. So this is really an exciting time because these tools are now actually available. We can now digitize a slide under a minute, and we can start looking at tools like image analysis, like AI, and that's becoming more of a reality in 2024 than 5 years ago. So, what is going on in the landscape of approval processes, regulatory environment? So, there are several scanners, three scanners at least, available, which are in the US, which are FDA approved. There is also an algorithm for prostate cancer detection and diagnosis, which was approved in 2021. So, all these devices and algorithms have made their way through the regulatory landscapes, and in overall, I would say this is a more favorable regulatory environment. And I think this was accelerated by COVID, where we labs who were digitally prepared were able to provide patient care, review of pathology cases more easily than others. So I expect in 2024 more devices will be approved, more algorithms will be approved. So if you look at just around the landscape of scanning devices out there, the consumers have more choice today. And if you look at the areas of pathology, like hematopathology, like renal pathology, cytopathology, there are newer devices and new functionality which is making its way into the hardware. So, as a consumer, you have choices uh, to look at cytology. So, this is an example of a scanner which is dedicated for cytopathology. Cytopathology and other modalities where you need to see three dimensionally, like Z stacking, where if you look at this cluster of cells, if I just scan them in this plane, I will only see that piece. But if I want to see the entire Z stack, this has to be scanned at multiple planes. And today's modern scanners have high throughput capacity as well as some functionalities like Z stacking, like multiplexing, like immunofluorescence. So this will become even more important in 2024 and beyond. We have other types of devices, like for example, this look at this device. It's the size of your palm, which if you compare it to the microscope, these type of devices will make connectivity and digital workflow and consultation and second reviews more easy. So look at this example here of a image, which is a cytology rapid on-site evaluation. So patient is from the patient's bedside, a needle aspiration is done, and a cluster of cells are smeared on a glass slide and put on this device, and you can actually show this to any pathologist you connect with. It's very easy to use, easy to navigate, and this is just one device, but there are today countless numbers of devices which have either ability to scan and forward live remote review of these types of cases. So, what does that mean for the patient? It means that the patient who is under anesthesia, who's looking for us, what is the cancer? Today, we have the ability to share this image with instantaneously instead of waiting for someone to come to the frozen section room or the FNA suite and provide this diagnosis in real time. So the images are of diagnostic quality. This is a given now with the technology out there. So diagnostic quality images are now a commodity. 10 years ago, we used to ask the question, how do you digitize a slide? That's no longer more as important as what do you do with these images? How do you improve patient care? How do you impact precision medicine? How do you impact precise diagnosis from the pathologist for the right patient? So I'm a prostate pathologist, and I'm looking at cases today, and these are some examples of images that are being generated from these scanners, where you can actually see the resolution at this resolution, the nuclear details, the nucleoli, which are important for the diagnosis. So getting these images, just to get to this point, it's taken probably 7 to 10 years to get FDA approval, get these images in front of pathologists. The next is, can we go beyond whole slide imaging? Can we do multi-dimensional scanning? Can we do scanning from a tissue straight directly? Can we create virtual stains? Can we do virtual H&Es and with virtual biomarkers? So I think that's where 2024 and beyond will focus on. But let's look at why is why is why are we in this position today and not 10 years ago? Aside from regulatory approval, it's the infrastructure. It's really the perfect storm where You have many vendors in this space, more than 10 years, more than there were 10 years ago, and you have cost effective, high performance computing graphic processing unit or GPUs, along with machine learning algorithms, similar to what you would have used in video games. We can now get these images to build and run parallel neural networks, which is the primary architecture for building AI algorithms. In addition, we have made a lot of breakthroughs working with vendors, working with scientists in creating artificial neural networks to model the network of a nerve cell in a human brain or a computer. So essentially, we're converting real intelligence to artificial intelligence, but we've gone beyond that. And that's been possible because of this improved infrastructure, cloud computing, more powerful GPUs. Thirdly, we have better data now. We have also have data which was in 20 years ago, 10 years ago, was locked up in a glass slide. We've opened the locked glass slides and converted that into millions of pixels, which is now available for review by pathologists, by scientists, so they can build algorithms, they can build methods to interrogate this data. So, in addition to all this, we also have an ability to build smart portals where we can bring the patient's information, the patient's demographics, patient's metadata, along with images and all the other analytics that are needed to create an informatics driven workflow. Again, this was has gradually come to a point where integration with the whole slide images are now possible, and the ability to start interrogating these images, almost like building app store on your phone where you buy the apps. You can start thinking of app store on your monitor, which can be used to build tools for you depending on what kind of pathologist you are. So we've really come to a point where you have an ability now today to use vendor agnostic scanners, LIS, and image analysis tools interchangeably, and be able to do this in the confines of a regulatory environment. So, a lot of progress, a lot of thought process has gone into designing these image management systems, which connect the scanners, the hardware, with a pathologist who can review these images in the context of the patient. So this is really the journey towards computational diagnostics. We are combining images, patient information, data, and tools to analyze this data together in one platform. And again, this is not in 2024, we still have challenges with this because we still have several different image formats from these scanners. We still have several different softwares that are being used. So it's not as simple as going to Apple App Store and buying apps and loading them on your monitor and start using them. But that process is very similar. It just hasn't been formalized yet. But we've come a long way from just be able to scan. So what are the reimbursement? So why should lab look into this? What are the reimbursement implications, right? So obviously, a lab wants to deliver good results. They want to improve the diagnostic accuracy and precision of the work that goes out of the lab. They also want to make pathologists more productive so they can actually do more cases, maybe not necessarily more cases, but have the tools to tackle complex cases and be able to use the 10 to 15% of the time or more to focus on the care of the patient, interact with the clinical teams. And finally, what is the bottom line, right? If you're going to use the lab's capital money to buy equipment, buy storage, buy software, you need to get a return on your investment. So how do we do that? So Some of the ways that we can do that potentially would have been we digitize the slide and we get paid for it. So the bad news is we still don't have reimbursable billing codes. The good news is that we do have class 3 codes, which are managed by the AMA. These codes are published annually, right, in the Federal Registrar. So in 2023, starting 2023, 13 new class 3 codes or add-on codes were available to the labs to start incorporating them into their billing, which were not reimbursable, but in the future these will become reimbursable. In 2024, more codes were introduced to be starting to use, for example, for AI algorithms. What does that mean, right? So it means that we use the codes, we maybe put a dollar amount of zero, but these codes will be used by CMS to monitor usage of digital pathology and maybe AI. So if you are a lab who's digitizing their slides, start incorporating these billing codes because it's going to help move the field forward in terms of getting reimbursable CPT codes, which will drive the adoption even more. So this is really an important thing for us to think about. What about other applications like telepathology? So if you're a dermatopathologist, you can set up a Mohs surgery process using some of these devices. If you are a solo practitioner, you can start thinking about creating ways to see patient biopsies from other states or other parts of the country while your lab is in a central place. I spoke with a dermatopathologist recently who practices in one state but has patients' biopsies being read from several different states. And he has a completely digital practice. He started by himself, now he has 9 pathologists. So this is not something which is trivial, right? And it's only possible today because we have the right infrastructure in place. We have cloud computing, something which we did not have a few years ago, right? So it really is the perfect storm. What about insourcing of consults, right? So this is what this practice is doing, and this is what several other practices are starting to get into, which is to extend their second reads beyond their own practice. They also create relationships with other pathologists. So if you're away on vacation, somebody can cover your practice. So all these are opportunities because of a digital workflow. What about consults, right? So you can actually create consultation portals like this one, where anyone can send a consult, even patients can send a patient directed consult from a lab to you for second opinion. So we've started doing this um, from different countries like Japan, and we're also doing it within different states. For example, reading cases from Mississippi or Wyoming. So these are only possible because of these tools that are being built. What about so these images are again of diagnostic quality, and that's thanks to the hardware that we have today, where we have achieved a resolution which enables pathologists to feel very comfortable with making a diagnosis on a digital image. Creating, for example, this is an opportunity if you don't have a dermatopathologist in your practice, but you don't have enough work for them, you would only need 20% of a dermatopathologist. You can potentially share the workload of a dermatopathologist by employing 20% of a pathologist who is employed by 5 different labs and is providing consultation services. So you can start thinking of creating virtual diagnostic networks and essentially create ways to review these cases. So with this, I'm going to switch gears to show you some of the things we've done in the last 5 6 years. Um, we we have uh, we now have a near digital workflow with excluding some specialties. So We started in 2016 and we worked with Inspirata to build a digital workflow with the help of hardware vendors and software vendor and integration with the lab information system. We were we went full scale digital pathology scanning services in 2017, and in 2018 we actually started signing out. We were the first hospital to sign out for primary diagnosis, and then in 2019 we switched to a different lab information system, and now we have over 3.5 million slides which have been digitized, uh, representing almost 500,000 plus cases. We're going to reach 4 million in May of 2024. So this is an exciting time. But I think we started thinking about, okay, now we can do digital. We can scan slides. We have a good standard operating procedure. And this is again has would not have been possible without the help of incredible technologists, incredible managers who are part of our digital pathology team. But now we're looking at what can we do now after we've done digitization. So this is where we started to focus on AI in 2022 and beyond. So the next part of my talk, I'm going to focus on, so these are some ways where we started creating data archives. We started going back into the archives and digitizing slides. We were able to provide telepathology services in remote hospitals that our pathologists were traveling to. So in 2024, we want to think about, can we now, instead of moving people, just move images, just like radiology does? And that's becoming more and more possible because of the infrastructure, because of the speed and the desired adoption that is needed, right? In 2016, it was hard for me to convince one pathologist or two pathologists to sign out digitally. But today in 2024, the opposite is true, where if we take away the system, people will get angry because they're used to the convenience of a digital review and the tools that are promised with AI and the technologies. So this is the central lab that we moved to right before COVID, and you can see this is a workflow where slides are prepped and digitized, but they're automatically assembled and delivered to pathologist workstations. I'm on service today. This lab is a few miles. This lab is, um, if you look at this lab is 4 miles away from my office. So I don't wait for the class slides anymore. Um, and this is the workflow. We can do tumor boards digitally now. We can do quality assurance, look at my cases in the work list. So all this is possible because of the digital workflow, which we've been building. We can see the links to individual images, which make this a more efficient sign-out workflow for the pathologist. What about reviewing images? And people always ask me, is it pixelated? Is it takes long to load? And that was the case 15 years ago. But today, with advances in image management systems and the speed of the internet, you can reliably pull these images and experience the same experience that a radiologist might have. You're able to review images instantaneously and share it. You're able to create visual cues like annotations more easily. So these type of tools are helping us build best practices, training the histotechs, training the imaging technologists, training the residents and the fellows of the future on these type of digital workflows. So this just shows you an adoption by pathologists, and you can see it's continued to grow. And we saw a peak during COVID, right? So it's been remarkable to see this type of adoption. It creates an environment for education and which is very dynamic, which is not static, and it's in real time. This is so. So the next thing is now, how do we take this adoption and leverage the use of AI tools? So all the things that we talked about today enables us to create really beautiful images which are diagnostic quality, which can be taken in broken into millions of pixels. The main thing I think it helps is pathologists today is to perform many complex manual tasks like counting cells, counting nuclei, looking for mitoses. Um, so if I gave you this jar and I asked you count all the blue jelly beans, it'll take you. It's a guessing game. But if I asked precisely pressed a button and it separated all the jelly beans virtually for you and gave you a count, it would make sense, right? So in pathology, specific uses of AI include pattern recognition and image analysis. So AI algorithms can be used to analyze digital images of tissue samples, identify features like morphology, size, architecture, staining patterns. And this can be done either by pattern detection, so you're looking at the overall picture and see, is it a pattern for cancer? Is it a pattern for infection? Or detect very specific features which will be very critical for precision therapeutics. Also, identify biomarkers which are important for disease like MSI, ER, PR, HER2/neu, and PDL1. What about AI algorithms themselves? They can be used to detect, classify, segment, quantitate, and localize. So let's go through these, one by one. So this is an example of an algorithm to look for mitoses, or to count algorithm to count key 67 signals. And you can see this is a field of view where the computer can look at very easily in this area which is analyzed how many blue dots are present and so on. So if I look at it at higher power, I can get an accurate estimation, accurate number of blue dots, red dots, yellow dots, and this is this number will be almost the same, very close to greater than 99% accuracy every time I press that button. So this is different than if I show this to 10 pathologists, they will have a different number every time, and even between the same pathologist. So inter-observer and intra-observer variability. So we can make it more objective, right? So if I tell you to count all the positive Q67 in this gastric neuroendocrine tumor, pressing a button, it'll take 28 seconds to analyze a 2 millimeter square area. So think about it, right? This, if I could do this in 28 seconds and I get the same answer every time, I can use the remaining 3 minutes per case to do other things, to call that oncologist, to read a book on the new translocations in kidney cancer. So it will reduce the overwork environment that you have with physicians and actually prevent a lot of physician burnout, especially pathologist burnout that we are experiencing today. Look at this. Like, this is HER2/neu in breast biopsy, a very important biomarker, but we do it very, very subjectively and manually. This method not only is more objective and reproducible, it's also more highly reimbursed. Maybe not more, much more, but there is a separate billing code for image analysis. So labs can start thinking of these tools and technologies and tie them with potential revenue sources. What about lymph node detection, right? This is an example of a algorithm which we can launch from our image management system to detect metastatic cancer in lymph nodes. Again, something like this would have taken us a long time to review. Typically on a busy day, I might get 10 trays of lymph nodes, each containing 20 different slides with each maybe 4 or 5 lymph nodes. So every single node has to be analyzed carefully by the pathologist, especially in cancers like treated breast cancer, where you can easily miss the tumor or small cell carcinoma. So looking at this is a lymph node with isolated tumor cells. So here is this tumor. What about if this was a patient with a tumor of unknown origin, and I didn't know what this tumor was? In the glass slide workflow or even a digital workflow, I would still have to order some immunostains and try to figure out, is this breast cancer, colon cancer? This happens to these type of cases come to you every day. Today I had a bone marrow biopsy. I'm on service today where the patient had prostate cancer, a lymphoma, and a history of bladder cancer. So morphologically, I can separate the lymphoma from the carcinoma, but I still have to do immunostains. But imagine a world where that is no longer needed, where you have algorithms running in the background which can predict with 99% confidence that this is colorectal cancer. Morphologically, it looks like colorectal cancer. It has glandular features, it has necrosis, but I still have to confirm it. What about gastric tumor? What about endometrial cancer? Those are not so straightforward to distinguish morphologically. But using algorithms, you can create methodologies to do this, not only simultaneously detect the cancer, but also predict what type it might be. So imagine the time that would be saved by the labs and the time it would be saved by the revenue, the cost that would be cost savings that would result from this process. What about as a aid to detecting cancer, right? So and precisely doing it, right? So there are now obviously algorithms which are commercially available, which can reveal, you know, can be used as a decision support tool by the pathologist to predict where the cancer is, what the grade is, and so on. So this is FDA approval of the phage prostate method, but similar tools can are going to come about with other cancer areas like gastric cancer. So today we have several cancers already where AI tools have been developed. Um, so this is the typical workflow where you can see in your work list. Some of these slides have been already tagged by the algorithm. So this can be done before the pathologist reviews them. It can be done during or it can be done after. So let's look at this. This is a method where the computer has created a heat map. An algorithm has created a heat map for the pathologist to review. So this is an example. Flipping a switch on and off, you can see that this enables the detection of cancer. What about cancer in breast cancer, right? So this is an example of pathologists using AI identified intraductal carcinoma that was missed on the microscope. It was picked by the AI tool. Not all areas, but some were missed by the pathologist. Again, these type of tools will become more easily available um, to the pathologist. So this is an example of finding microcalcifications in a biopsy, a process which could take a long time, and repeated deeper levels are taken. So this is a live mode where you can see breast biopsy and detecting breast biopsy. Again, example of breast cancer detection using AI algorithm. So the possibilities are again going to increase. We're in 2024, and some of these tools have been built in the last 2 3 years and more. But imagine as the library of apps become bigger, these will become available for precision pathology in your digital workflow, in your workstations of the future. This is an example of melanoma detection and diagnosis, where an AI versus international experts are reviewing this diagnosis of melanoma. So this is an example of an AI-based digital cytology platform where the computer has identified areas of cancer and provided those cells. Uh, this is a slide where pathologists are often asked to segment areas of cancer. Is it carcinoma? Is it benign? Is it stroma? Is it necrosis? Is it adipose tissue, and so on? Uh, so using artificial intelligence, we can now segment these different areas. And this normally would have taken a pathologist 3 to 5 minutes, just roughly estimating all these different segments. But today we can do this in real time. Again, sometimes we are asked to review a patient's cancer slide prior to treatment and then get a biopsy after treatment and give a prediction of how much necrosis is there. These type of tools will allow us to do this in real time, more objectively, and more faster. What about quantitating mitoses? So today we have several vendors who have built great applications to identify features like mitoses. So this is an example of a mitotic figure detection using artificial intelligence, where you can see this cancer, and the computer is identifying the different areas of mitoses, which otherwise would have taken several minutes per slide, and also more subjective diagnosis using a manual workflow. So the point of showing you all these apps are that we've come a long way in using and building AI, but there are still labs who have not even bought their first digital pathology scanner. So when they do, some of the questions to consider is, does AI really work? Are we there? Is it all hype? Does it make pathologists more accurate? Does it make pathologists faster? Does it save us money? And these are exactly the questions that labs are trying to address. And the short answer is, you don't need a high throughput complete digital workflow to start using AI. You can make it very, very directed towards prostate biopsies, where you scan only the biopsies, or derm path, or GI. But the good news is those apps are becoming more and more mature, and they will get better with time. So we're going from artificial intelligence, which is, we talked about, which are task oriented, typically single algorithm per task, benign biomarker quantification, mitosis count, grading, rare event. All these are task oriented. When you compare this to the real intelligence of lab professionals, it's more goal oriented. We're probably running many algorithms in our brain, and it's experience based, it's knowledge based, integration of multiple diseases and types of data, and it's also context based, right? So this is an example of a case where I reviewed this. AI called it this and this from the same patient as prostate cancer, but um, um, if you look at this, when I looked at it again, it I thought this looks a little different than prostate cancer. It looked more like colon cancer. So again, with the best of AI tools, you have to evaluate them individually. As a pathologist, you are ultimately responsible for the diagnosis. So putting it all together in 2024, we now have the capability to build smart dashboards, smart portals, bring the information and the pieces together for accurate and timely treatment decisions. These may change, the output and the monitors may change depending on the type of information. In the future, you might not even need monitors, they might just be holographs, which you can move around just like a science fiction movie. Uh, but in general, I think of AI tools and a digital workflow will help us assist the pathologist, will augment their diagnosis, or in some cases, provide autonomous diagnostic, processes. Um, so AI-powered pathology is here to stay. It's helping us connect to pathologists, gain access to pathology image data for institutions and for patients. And we have to start now designing more diverse workflows where we can build third-party apps into the image management system, which is something that's not easily done today. One or two apps could be incorporated into your current image management systems, but the ones that we design in the future will need to have this. This is going to be important to deliver compelling return on investment decisions by the C-suite, by the business managers of your labs. But what is exciting to me is not something which we can do very easily today, but maybe in the research setting where you can now start to predict genotype or phenotypic data from H&E pixels. So imagine that world where you don't have to do extensive high throughput genomic assays, but get those similar answers using H&E images directly from your monitor and assessing this type of possibility. So this is an example of predicting BRAF mutation status in melanoma or PDL1 checkpoint inhibition directly from a H&E slide, which is digitally available. So multiplexing. So these type of technologies are again not readily available for clinical use today, but they will play an important role in the future. So finally, look at this image of a benign prostate and a cancer prostate, which you can rotate and review in real time using digital uh, pathology, AI, and 3D imaging technologies. So this is an example of virtual staining using H&E, which is so on the left hand side you have H&Es which were stained in the lab and digitized. On the right hand side you have computationally generated H&Es. So if you can tell them apart, it's you're good because I sometimes cannot. Because so when we think about digital pathology, it's not just scanning. We have to think about the entire spectrum, all the way from patient bedside to the gross room, to the histology lab, to the immuno lab, and beyond. Even looking at tissues and generating H&E images directly from the tissue. So we are in it again is the perfect storm of adoption and technology maturation and infrastructure strength, which has enabled us today in 2024 to start using these tools in real time. So, what is the road ahead, right? So, we have to start thinking about computational diagnostics for areas beyond just surgical pathology, like renal pathology. We have to start thinking about storage. Where do we store these? How do we compress them? How much compression is good enough? We have to continue to deploy solutions and have bring it in front of pathologists, the end users, so they can experiment with it. We can start creating smart dashboards that will make it not only have these images available for clinical care, but also de-identify them easily for research, for education, and beyond. We have to continue to push on additional revenue streams from digital workflows, CPT codes for image analysis, CPT codes for whole slide imaging and AI, and integration of pathology data and workflows to really create computationally enabled integrated diagnostics, more precise for the right patient with the right diagnosis. So with this, I'm going to end. I know I may have gone over a little time, but we have time for questions. So I want to thank the audience. This is a topic I can probably talk for hours. I probably have another 300 slides, right? But I'm going to stop and see if there are any questions from the audience. So thank you so much for your attention.
Yeah, thank you, Dr. Parwani. I know I'm speaking for everyone when I say we appreciate both your expertise and your insight into a really exciting and growing field of pathology. So yeah, we'll go through a few questions. The first one we have: how do you think that everyday pathologists perceive digital pathology, computational pathology, and AI?
So I think there are groups of pathologists who are just scanning their slides. They're experimenting with what is a good image. Can I see nucleoli? Can I see mitoses? So their perception is different from a more advanced user who now is taking maybe not a complete digital workflow, but is taking AI tools and using them to solve some of those manual tasks. Like some of these tools, there are tools now which can help you quantitate the number of nuclei, and these are sometimes available on the internet, available as decision support tools. So I think the perception is still very different from adopters, early adopters, mature adopters, and non-adopters. Non-adopters, I think some of them are still afraid of the tools and technologies. They're afraid that just like any other technology, this will this is an attempt to replace them. But I want to assure everyone that it's far from the truth. We're in the face of shortage of technologists, shortage of pathologists. This is not going to happen very easily. So we are better off adopting and learning new technologies than trying to resist it, right? Just imagine your first smartphone when you got it. You had to think about it. Am I ready to spend that kind of money and transition from that flip phone maybe you didn't do that. I had to go through that transition. But I think there is excitement, but also fear amongst users as they perceive digital pathology and AI.
Mm. So what do you feel are some of the main advantages of these technologies in the day-to-day laboratory routine, and what are some of the disadvantage or potential risks or pitfalls?
So I think the advantages are some of the things we highlighted, which is um, we are able to do the things that would take hours into minutes. Moving images is much easier. Counting cells is much easier. Collaborating and showing cases to each other is much easier. Education is easier. Research is easier. And so those are some of the advantages which are prompting and leading to more adoption. The barriers are I'm afraid that somebody will build an AI tool in their basement and start using it. So the regulation has to be carefully done. There is also the ethical side of AI use, right? Do How informed is the patient that we actually use an AI tool to make the diagnosis and not 100% diagnosis from the pathologist. And it happens already in medicine, happens already in radiology, happens in other parts of medicine, cardiology, happens in our everyday life, right? Even when you go through baggage security, through TSA, AI is being used to check your bag, and the human is only confirming it. These, this knowledge and this aspect should be disclosed to the public about when we are going to use these, and it has to be also used in a manner which is fair, it's ethical and uh, carefully used, right? Not just used with caution until it's approved and it's more regulated.
Mhm. Our next question here: how can developers and designers make computer-based technologies more appealing and approachable to pathologists?
Yeah. So at the end, it's all about how you present this information and make it easier for a human to interact with. So it's all about user interface design, where you bring the right information for the right disease to make the right diagnosis for the right patient. At the end, the visual appeal should be good. The type of information and the clustering of information, the visualization of data, has to be carefully presented. I've seen great systems fail because they have a lot of capability and functionality, but it's not presented to the users, in the context that they need, with the visual cues, with the graphics, with the illustrations, with the ability to interact with the data in a dynamic way. So I think those systems are going to be more successful, right? Like your workstation should be so good that you don't wait for the hospital to buy it for you. You want to go out and stand in a line and use your paycheck and buy it. That's the kind of systems that will be appealing and exciting, but they're not there yet, right? There are some which are making improvements, but they're not there yet.
Very nice. So how can digital and computational pathology users help introduce colleagues to these technologies?
So I think it's show and tell, right? You have to, if you found a good way to make a diagnosis, show it to your colleagues, show it to your friends, so they understand the value of it. They understand, like oftentimes you will go to a new town and you will look for a new restaurant, but you're going to go to a restaurant which someone has actually recommended you. You know about it. So the same thing with these tools is the experience count, the context counts, the visual cues count, right? So the more information that your colleagues can provide about the system and the use, and that will increase the adoption. I remember uh, when we first launched, we had manager in our digital pathology scanning center, and she was always creating user group experiences, showing people the tools that are needed, which drove the adoption. So I think that is important to tell people around you.
Yeah, it's great feedback. So we have time for one or two more. So next question, where do you think this kind of AI technology will go in the near future? And additional to that, how can we ease the adoption process for pathologists as the AI technology becomes increasingly prevalent?
So I think the next phase of this technology will be uh, more an intuitive ability to take the data and bring it to the end user in the context of the patient. But right now, when I go and log into my image management system, I still have to manually highlight certain regions. I still have to manually extract the results and incorporate them into my end report. So I would say more multimodal reporting will come, where AI will not only take the image, the analysis, and also the context and build smart reports for you. And I think that's something which is will require more vendors to work together carefully and design systems that are synergistically aligned to to address some of these needs. The when you when you think about the adoption process, it takes sometimes it takes baby steps. So we need to take those baby steps. You're not going to press a button suddenly and wake up and things will happen magically. You have to take the baby steps of scanning your first slide, looking at your first slide on a monitor, clicking a button and collaborating with your first colleague. And so my approach to adoption of technology is grow it organically, grow it by having the user seek the adoption, not you pushing the adoption. Right? So it's not just going to a new hospital and switching on a tool. It's about people willing to use this tool, people who believe in the technology because they've seen others around them using it. So I think that's the message I would really think it is important for adoption, and that has worked for me in the last, I would say, 20 years of embracing new technologies and providing it to the end users.
No, that's fantastic, and thank you. As we're nearing the end of the presentation here, thank you for taking the time to answer those questions. Thank you for taking the time to speak with us and give us some more information on AI and digital pathology. And also a big thank you to everyone in the audience as well. We'd love to speak with you about DXRX, so please check out the link to book a meeting, both on the left side of your screen and in the exhibit hall in the DXRX booth. We'll have more sessions in this event space in the coming months, so please be on the lookout for those. We hope to see you there, and thank you again to Dr. Parwani, and we hope that everyone enjoys the rest of their day.
Thank you, everyone. Thank you.